Welcome to this special virtual luncheon with our one and only District Governor for 7030, Debbie Rupchan. My name is Sharon Cordner, and I will be your moderator for this webinar. And I'm ably assisted by Victorio Morpurgo, who is our co-moderator and timekeeper. Before we start this webinar, I ask you all for a few moments of silence in respect of our dear fellow Rotarian who passed away on the 8th of February, 2025, Dr. Kenneth Niles. He was a guest at the table of immediate past District Governor Brian Glasgow during the lunch webinar, where he spoke about the importance of addressing the mental health of youth in relation to childhood obesity. So we'll start for the moment of silence. Thank you. Before I hand the Zoom over to our host, District Governor Debbie, some house rules. I hope you all have your lunch with you so that we can have a healthy, big family lunch together. I invite you to share in the chat box what you are having for lunch. This session is not set up for questions and answers, but feel free to take pictures of your lunch and add them to the comment box while DG Debbie is chatting with us and her guests. And now, without further ado, I present District Governor Debbie.
Thank you so much, Sharon. Welcome, 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 everyone. So nice of you to join me for lunch today. Let me tell you what I'm having for lunch. Salmon with tamarind glaze, herb roasted potato, and green salad. This is again a special luncheon because I have invited some very special persons from the Caribbean who also represent the international community to join me for lunch. We are in our 5th year of the Childhood Obesity Prevention Program, and I'm proud to say that clubs in the 17 countries in our district have embraced the Childhood Obesity Program. It is in their plans, there's an allocated budget, and what is even more exciting is that all clubs in countries are coming together to do more and more impactful community projects. Talking about obesity is talking about policies to tackle the obesogenic environment that negatively impacts body weight regulation, taking into account the built environment and the food environment. A built environment that facilitates and stimulates physical activity and community or backyard gardening is as important as a food environment that stimulates and promotes healthy eating and drinking. It is also talking about safe spaces and policies to tackle dangerous and risky environments around children. I will speak with my guests about the importance of the Rotary District 7030 COP program aligned with and complementing regional efforts to guarantee the child's wellness. And I'm thrilled to have as guests the representative of the Ministry of Health from Antigua, who's in the room with me, the United Nations country representative, and representatives from the World Obesity Federation. And of course, I'm in Antigua, representatives, the 2 presidents of the Rotary Club of Antigua are also here with me. Now, moderator, over to you to introduce our guests.
Thank you, DG Debbie. Today we have 4 special guests with us, and we're going to present them in the order in which they will address us. We have with us in our presence Samantha Moet, who is a registered dietitian nutritionist, who is currently the Chief Nutrition Officer at the Ministry of Health and Wellness in Antigua and Barbuda. Her main areas of work include tobacco regulation, projects to improve child health and prevent non-communicable diseases in Antigua and Barbuda. She completed her studies at University of Texas Southwestern Medical Center, where she obtained a Bachelor of Science in Clinical Nutrition and went on to complete her Master in Public Health at the University of Massachusetts. Samantha also holds qualifications in group fitness and yoga and currently lectures courses in nutrition at the University of the West Indies, Five Islands, and the University of the Southern Caribbean. She enjoys spending time with her daughter and gardening. Samantha Moit. Next up, we have Miss Joanna Kazana of Poland, who has served as United Nations Resident Coordinator in Trinidad and Tobago, Aruba, Curacao, Suriname, and St. Martin since June 2023. She has over 20 years of experience in international development cooperation. Prior to this appointment, she was the UN Resident Coordinator in the Republic of Belarus from 2018 to 2023. Earlier, Ms. Kazana worked for the United Nations Development Program, UNDP, in New York, and from 2005 to 2010 served as Deputy Representative of the UNDP in the Ukraine, where she led creation of one of the UNDP's largest local development projects, community-based approach to local development in Ukraine. Ms. Kazana began her professional career in UNDP office in Poland, where she worked as a UNDP National Program Officer in Warsaw, also as an international consultant for the United Nations Program on HIV/AIDS, and as an advisor on international program development and harm reduction for the Soros Foundation. She holds a master's degree in economics and international relations from the Warsaw School of Economics. Ladies and gentlemen, Ms. Kazana. Next up, we have Johanna Rolton, who has been a CEO of the World Obesity Federation since 2017, working with over 100 member organizations from across the globe and expert board and committee members on delivering the Federation's priorities of global advocacy, convening, education, and data and science. A new 3-year plan launched in February focuses on continuing to expand and strengthen action on obesity from prevention to management, working with members of WHO and other key stakeholders. Previously, Joanna was CEO of the World Heart Federation and Vice President Global Affairs of the American Cancer Society, where she led global cancer and tobacco control programs. She's a citizen of the United States of America and Sweden and is a lived experience advocate. Also joining us this afternoon, we have Yele Fawara, who is an experienced professional in the nonprofit sector, currently managing World Obesity Day at the World Obesity Federation and leading global communications with our members. With a strong background in women's health, she has worked on initiatives related to gynecological cancers and maternal health research at St. Thomas's King Hospital and King's College, London. She holds a Master's of Science in Women's Health from UCL, University College of London. Passionate about equity, diversity, and inclusion, Yele has contributed to events exploring diverse health experiences and is dedicated to amplifying underrepresented voices and placing people at the heart of her efforts. So we have a fantastic lineup of guests, and again, a very warm welcome to all. I'd also like to acknowledge the presence of our Assistant Governor for Antigua and Barbuda, Jonah. And now over to you, District Governor Debbie.
Thank you so much, moderator. It really is a pleasure and an honor to be in the presence of such distinguished company to talk about a problem that concerns the entire world, including the Caribbean. But before we start our chat, since this is a lunch meeting, I'm curious as to what healthy, sumptuous meals you are having for lunch. Sharon? Dear participants, feel free to share in the chat with all of us what you are having for lunch. at this point in time. In the preliminary talks, you would have heard me speak about the initiative from Rotary District 7030 to make childhood obesity prevention a priority for our district. Given your background, I don't have to provide you with data to justify our decision. Adopting childhood obesity prevention as a district priority program in 2020 was a no-brainer for District 7030. We are the bridge between policymakers and the target groups in our communities. We are convinced that our organization, Rotary, is the secret to help meet the 2025 global obesity target. Rotary District 7030's COP not only aligns with the action plans of regional and international institutions, but its pillars for action, advocacy, accountability, capacity development, communication, and sustainability are also in sync with the Rotary four-way test of the things we think CO do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Again, welcome, and please feel free to chip in with questions and/or remarks to each other in the chat box. This is supposed to be a loose and flexible lunch. And just like we would freely chat with each other when we are physically together, it is my hope that we would achieve the same with this virtual lunch webinar. So let me start with our government official from Antigua, who is seated with me on the room, Ms. Samantha Moffat. Samantha, maybe you can share with us a brief history as to your professional experience and, of course, your perspective of the system's approach in childhood obesity prevention.
Sure. Thank you, District Governor Debbie. So nice to be here discussing this very important topic. So in Antigua, as introduced, I work in the Ministry of Health as the Chief Nutrition Officer. And one of our mandates is to help in the reduction of non-communicable diseases, including obesity. So we have quite a few programs on the ground currently occurring to help as a public health umbrella to help the community to deal with this challenge. If you allow me to share my slides, I just have a few slides and we can get into that. All right, so just a highlight of some of the programs that we are doing and are looking to do. So one of the biggest is the sugar sweetened beverage policy, taxation policy. And we'll also look at our BFHI, Baby Friendly Hospital Initiative, and then a regional obesity project, which we are currently in the process of doing. So with regards to the sugar sweetened beverage policy, also known as the SSB policy, this is a proposed health levy on sugar sweetened beverages. What we do know from data is that the overconsumption of sugar sweetened beverages such as sodas, juices, have increased obesity worldwide, especially in the Americas. So this regulation or restriction on the sale and marketing of SSBs in schools and public healthcare settings is very important for us to help to decrease that. What we are recommending is that it helps to reduce the intake of added sugar, given the concerns of the escalating problems with overweight and obesity and non-communicable diseases as well. The levy will be applied to drinks with added sugar specifically, but not limited to fruit juices, sports drinks, sodas, energy drinks, sweetened teas and coffees, flavored milk. And exempt, you would have 100% fruit juices or vegetable drinks, without no added caloric sweeteners, baby formula, any beverages for weight reduction or medical use, and alcoholic beverages. So in terms of what the policy looks like, is that the revenue from this policy should be used for health promotion with the priority to increase and promote physical activity in schools and healthy nutrition in schools. Also, with the ban of sugar-sweetened beverages, we're going to be promoting more water in schools as well, more water intake. The restriction just does not stop in the schools, it's around the schools as well. I know in several countries they may share similar issues of tuck shops or vendors around the school compounds, and they too will be targeted as a part of this policy. So moving on to our baby-friendly hospital initiative. So our lone public hospital, the Sir Lester Bird Medical Center, achieved baby-friendly status in 2023. This is status by WHO and UNICEF, and Antigua this is the first time that we've had that status. What this means for us is that we now are able to ensure that the mother and baby diet receives timely and appropriate care during their hospital stay to enable the establishment of optimal feeding in newborns. The optimal feeding we are going towards is, of course, exclusive breastfeeding for the first 6 months of life. This initiative is very effective in increasing breastfeeding initiation. As a matter of fact, our reports show that in Antigua, our rates of breastfeeding initiation is over 90%. Exclusive breastfeeding, which we're still working on, and breastfeeding duration, meaning going above and beyond the 6 months for as long as the baby and mom diet allows. The benefits to baby, which is what comes back to the systems approach that we're talking about today, is that it helps. A lot of studies are showing that it helps to protect the child from a number of illnesses, including childhood obesity. So this is a very important initiative. The last initiative, the Regional Childhood Obesity Project, is something that's ongoing. It's a regional body composition study in primary school children, sponsored by the IAEA, and it assesses the status of childhood nutrition and malnutrition and obesity using stable isotopes. So just to give you some highlights from that, we're measuring body composition, so fat mass, lean mass, body water mass using stable isotopes. And we are also measuring the children that participate, their activity levels, giving them a pedometer to wear for a week. They will also be answering questionnaires on their dietary habits, screen time, activity, and sleep, as we know all those can be risk factors for obesity. The recruitment is approximately 150 children, and this is going to be taking place in 9 countries. The initial data we expect by the end of this year, 2025, so we hope to share it and have some good news, hopefully, and also a plan forward in how we will deal with childhood obesity in the region. Thank you.
Samantha, thank you so much for that very useful information. And just to share with you, in Trinidad and Tobago, since 2017, we implemented a ban on the sale of sugary drinks in our schools, the government schools. So it's really great to see the work that's happening in Antigua. I would like to move over to our United Nations representative, Joanna Kazano. Joanna, great to see you. A systems approach is important in the fight against childhood obesity and to achieve good health, wellness, and well-being in the child. Joanna, how would you, as a UN representative, respond to that statement?
So first of all, thank you very much. Good afternoon, colleagues. Delighted to join you for this lunch meeting. It's fairly early for me to have lunch at this time. I have given to the experiment of intermittent fasting. So I'm with you to enjoy food, but today I'm actually not eating at this time. So I also appreciate your support in this effort. I want to first of all, also thank you for the invitation and for the opportunity to contribute to the conversation about non-communicable diseases and prevention that you have been so incredibly supportive of. And I want to congratulate the Rotary District and the MOVES initiative to prevent childhood obesity the whole campaign is extremely important. I'm based in Trinidad and Tobago, but I also cover Aruba, Curacao, San Martin, and Suriname. And I would like to present to you the global perspective that the United Nations takes on the issue. And if I repeat something that you already know, I hope it's not going to be boring. It is very useful for us to realize what are some of the key statistics globally and how much the non-communicable diseases dominate in the medical problems that the world has to tackle. So obviously we are talking about a variety of problems, which include cardiovascular diseases, cancer, and diabetes, but also chronic respiratory conditions, which are the leading cause of death and disability globally. We are speaking about 71% of all deaths, premature deaths, claiming 41 million lives each year. And I want to highlight the urgency of addressing this crisis in a systemic way. We already heard the example of Antigua. We already also heard about the example from Trinidad in limiting access to sugary drinks. But this kind of policy work has to be enforced across the region and broadened to attack this issue from other dimensions. What is very important from the global perspective is to understand that this is a problem of poorer communities. Obviously, many of these deaths could be prevented through timely medical intervention. But sadly, 86% of premature deaths out of non-communicable diseases occur in low and middle-income countries around the world, where, first of all, the healthcare system often lacks resources, but also the food is of lower quality. The accessible and affordable food is not the best kind of food. Obviously, among the leading causes of the non-communicable diseases, cardiovascular diseases claim nearly 18 million lives every year. Cancers take the second place right after cardiovascular diseases, and then the respiratory problems that I already mentioned. And the last one is diabetes. Key factors. You hear about them a lot, but I think it also is very important for us to keep track and remember that the key risk factors are smoking. Tobacco use is responsible for over 7 million deaths per year. Diet that we are discussing today, second very important risk factor, which is leading to conditions like obesity and high blood pressure. Physical inactivity is contributing to 1.6 million deaths annually. And the harmful use of alcohol is causing millions of deaths, particularly due to cancers and liver diseases, not to mention accidents, workplace accidents, driving, drinking and driving, that has the unintended impact also on the broader community. Also violence, which is connected with the excessive use of alcohol, has an additional burden on the community level, on the family relations, or on the relationships in general. And then it has lasting mental health consequences. So very complex set of problems connected with the use of alcohol. And the last point that we mentioned also as a risk factor is the air pollution. Perhaps here in the Caribbean region, it is less so problematic, but I, coming from the Eastern European part of the world, can tell you how important that part of the prevention agenda is to prevent air pollution, especially in the domestic sector, in the houses, where the cold weather requires closing of the doors and windows. And at the same time, people are using very simple burning devices to heat the homes and cook the food. Preventing and controlling the non-communicable diseases requires a really complex approach. involving both the individual actions and policy-driven solutions. And today we are talking about diets and obesity, which is connected with the lifestyle and the food choices. But these are, much broader policies that could come into play that can really advance countries' progress in eliminating the excessive early deaths. The PAHO, which is the UN system authority on these issues, and WHO globally, World Health Organization, they're talking about something that they call best buys, which they call the most effective interventions, which can significantly reduce the non-communicable disease risks. One of the best buys is the taxation policy. I think colleagues have already alluded to it. I think that there's enough research already to prove that implementing taxes on tobacco and the sweet beverages is extremely beneficial. There are countries which have increased the taxation on not only tobacco, but also alcohol. And the proceeds from this increased tax go to the budget of agencies which are dealing with the problems of drug addiction, alcohol addiction, every other kind of addiction. There may be other ways of using the increased tax revenue, but the tax mechanism, tax instrument remains an extremely important one in generating the funds needed to do more awareness raising, more prevention, but also create a barrier, a price barrier for those who may be sensitive to that kind of disincentive when they choose, the different kind of options of what they want to consume. Enforcing regulations and limiting the advertising of unhealthy foods, especially advertising targeted at children, this is something extremely important. The first requirement for the food suppliers and in the marketing was to require, the exact labeling and exact information, provision of information, basic facts about the contents of what's in the package. But generally, regulating the advertising has become, a kind of a more complex undertaking. And as we know, advertising always has fairly big budgets and is a very, very strong tool in the hands of the food producers. So how to enforce regulations and limit the advertising focused on children, it's a key best buy or a very cost-effective intervention that can be contributing significantly to the reduction of the NCDs. Another way in which states and policymakers can succeed is to encourage urban planning that promotes physical activity. It's not only about allocating enough space for the green areas, for the parks, for the recreation facilities, but also encouraging people walking or people going by bicycle to reach the places where they usually have to go every day. Planning of the community spaces in such a way that you can go safely on a walk, during the day, take a 15 minutes break or half an hour break, go for a walk in the evening, have a run if you're a runner. These are extremely important urban decision or urban planning considerations that need to be taken into account. I think here in the Caribbean, what I'm discovering is that there are cities and countries which encourage walking, and there are cities and places which are extremely difficult for people just to enjoy the sort of space in which they're working or living. There's very little walking to wherever you want to, wherever you need to go. You want to go for lunch, you have only one option of a place which is close by. You would like to walk a little bit further, but either it's too hot or it's not safe or it's just not a common thing to see that people are walking the streets. There are quite a number of examples of successful interventions. One of such examples is the Hearts in the Americas program, which is aiming to reduce high blood pressure through community health initiatives. Similarly, there is the Trinidad and Tobago Moves initiative, We are very happy to be also promoting physical activity and healthy eating habits from childhood to adulthood. Trinidad and Tobago is also a good example of a country where, of course, the challenge is pretty significant. The non-communicable diseases account for about 62% of annual premature death, or annual deaths in general, with 45% of these occurring prematurely in people under the age of 70. This not only impacts the individual health, but it's also impacting the economy, the workforce productivity, and the healthcare system. So, of course, there's lots of issues that we could discuss as particular aspects of these problems. But maybe before I end, I will highlight to you the kinds of programs and supports that is coming from the United Nations projects where collaboration between agencies such as UNICEF, PAHO, WFP, and FAO has proven to bring concrete results. The first example is the UNICEF program, which is helping governments to have good statistical baseline and providing data, critical data on child and health and child nutrition that is really essential in decision making. Another such instrument, data set that is very, very useful is the so-called STEPS survey that is conducted by PAHO WHO in partnership with the governments of the countries we serve. And that's really unique, very detailed, and extremely useful for the policymakers, for the decision makers in focusing their resources on targeted programs which should advance and bring improvement in some of the critical areas. In addition, I think it was already mentioned that PAHO has been helpful in certifying hospitals as baby-friendly and promoting better breastfeeding support for mothers. Another example of the things that can be done and are happening here in Trinidad and Tobago is use of artificial intelligence in designing or improving school nutrition. On the UN side, the World Food Programme has helped to introduce the AI-driven meal planning tool to improve school nutrition outcomes. And the last one that I want to share with you is the FAO example in partnership with the government of Mexico, so not exactly here in the Caribbean, but close enough, which has launched the Resilient School Feeding Program to establish national nutrition guidelines for children. At the global level, this year we are looking forward to the 4th high-level meeting on the prevention and control of non-communicable diseases. It will be a very important moment for the global leadership to reaffirm commitment to this very important agenda. And I think that as we approach this milestone, it's really very important for us as a community on the ground to actively participate in shaping policies that prioritize public health and to really help establish the value of prevention and the actual, and describe the positive outcomes and measure those positive outcomes also in a positive value as compared to the potential problems that are going to be there or are going to have to be challenged in case there's no prevention effort. So this is what I wanted to share with you today. And I think that obviously, there's more that would be said very specifically on the issue of food choices. I always say that, we are what we eat, and individually we are making a very important impact on the rest of our environment and communities. In my office, I have eliminated not only plastic bottles, but we have also started ordering food and catering events from the local food producers, from the organic food producers and small players. Instead of going to a big massy store and buying off the shelf, we are working with the, with the food providers from here. And those small mom and pop shops are able to perfectly cater for small events with the homegrown vegetables and sometimes meat as well. making our food choices much healthier. And this is a very important choice that we as managers have. You know, we can order food from a big restaurant, but we can also order from the local food provider. We can also do quite a lot to advocate for stronger public policies, but also support initiatives that reduce the risk factors in our communities. I always give an example, and this is my last point. I always give a very good example of my former boss, Helen Clark, who was the administrator of UNDP, and she's also former Prime Minister of New Zealand, who prevented us from working with the companies that were producing sugary drinks. We, as the United Nations organization, were not able to sign contribution agreements and cooperate with the huge multinational companies that wanted to fund programs at the grassroots level. And we were talking about hundreds of thousands of dollars, because our leadership took a principled decision that we are not going to take money from those who are harming the rest of the population. So those kind of choices are not so easy sometimes at the, individual space in which we operate, but courageous steps which are kind of breaking the mold and breaking the habit and the sort of easy way of doing things are quite significant as well. Thanks very much. I spoke probably for longer than what you wanted me to use, but it's a great opportunity and I wanted to share as much as possible.
Thank you. Thank you so much, Joanna. And the information you have shared is very useful, so I don't mind you going over briefly. Just to share with the participants, and you mentioned that the baby-friendly hospitals. I had the opportunity while here in Antigua to visit the Celeste Bird Medical Center, and they are certified by PAHO as baby-friendly. And it piqued my interest because I wondered, how many hospitals we have across the Caribbean that may, in fact, be certified. So thank you again. Moving over, I am going to move on to our World Obesity Federation representative, Ms. Johanna Rolton. And Ms. Rolton, it is a sincere pleasure to have you here today representing the World Obesity Federation. Congratulations with the commemoration of World Obesity Day, which is celebrated around the world. Rotary District 7030 is pleased to join this advocacy and awareness movement. Now, as the initiator of the World Obesity Day, I invite you to talk to us about what your organization does to support and contribute to the fight against childhood obesity. And can you also share with us how the WOF can collaborate with Rotary International to work together to implement interventions? How can we foster partnerships to collectively achieve regional and international goals and targets?
Thank you so much, District Governor. First of all, my colleague Yele was going to present the first 3 slides. Could we maybe shift the spotlight to Yele? She leads our World Obesity Day program and was going to speak concretely about this. And then I will come back in and give a big picture. Great. Yele, take it away.
Lovely. Great. Can everybody see my slides? Is that great? Perfect. So so my name's Yele. I'm the Campaigns and Membership Coordinator at World Obesity, and I'll just take just a couple of minutes to go through the World Obesity Day theme, assets, websites, and how members and supporters from the Caribbean can help amplify the World Obesity Day theme and campaign this year so that we can have an even bigger impact. So starting off with our theme, as you'll see from all of our Zoom backgrounds, this year's theme is Changing Systems, Healthier Lives. And what it really calls for is a shift of focus from individuals to the systems that are shaping our health. So of course, as a lot of us may know, obesity is often seen as an individual issue, but the reality is much more complex. We've got failing systems, whether it's in health, in food, regulatory, marketing, government, even urban design, as we've heard from the previous speakers, are driving rates of obesity worldwide. And these systems impact the care we receive, the food we eat, the environment we live in, and they also perpetuate obesity as a chronic disease, as well as a driver of related diseases as well, whether that's heart disease, diabetes, or cancer. And so what this theme for World Obesity Day 2025 is really about is uniting people with living with obesity at the centre, as well as uniting our governments, health professionals, regulators, and the public so that we can transform the failing systems and create a healthier future for all. Now, what does that look like? We've got our website, which is currently live. It does have a couple more updates than this, but up on our website at worldobesity.org, you're going to see our key message, which I've just briefly run through, as well as a theme, but also importantly, our advocacy toolkit and campaign assets. So if you're looking to amplify the World Obesity Day message and really push away from that idea that it's about individuals, but shifting more towards the systems that are at play, then we've got all of our campaign assets ready for you to use and share. As well as on our website as well, if you do have any sort of campaigns, any events, anything you're doing to commemorate World Obesity Day, then we do also invite you to share your story as well. We do have a map, sort of world map, on the website as well, where we're able to populate it with the different events that are happening all around the world to commemorate World Obesity Day, and would love to have many of those featuring within the region of the Caribbean as well. So just to briefly go over the assets that we do have up on the website, we've got things such as email signatures, Zoom backgrounds, the logos, the video intros and video outros. So if you are planning to do any sort of media around, I don't know, a TikTok or an Instagram reel or any sort of general video, then we do have assets that you can use just so we do have that unified look when it comes to World Obesity Day as well. In terms of events, so if you do have your events ready, that's great. Then we do encourage you to share that on the website as well. But besides that, we do have 2 or 3 key events that are sort of at the heart of World Obesity Day. One of those is the Walk for WOD. So this will be our 2nd annual Walk for WOD World Obesity Day, which is just about uniting globally by walking to raise awareness and inspire action. And again, if this is an event that you would like to take part, you'd like to organise, whether as a group or as an individual, then please go on to our worldobesityday.org website to register it there. Other things we do have is illuminating the monuments. So if you do have any significant monuments within your local region or national regions within the Caribbean, then please, we do invite you to illuminate the monuments with the colour purple as chosen by our Global Advisory Group in order to signify World Obesity Day on the 4th of March. Other events that we do have and that I might be asking you all to take part in later on in this webinar is making the oath for obesity. So this is just a simple way to share your oath for obesity, to show your support for World Obesity Day. So this is something very simple you can do as an individual or group, grab a friend or whoever else, and send us your photos, tag us at World Obesity so that we can help spread the word as well. And just to finalise on a couple of things that we do have coming soon, and one key thing that I'd like to highlight is our global case study videos. So while this campaign is about a shift of focus from individuals to systems, we're trying to shine a light on the systems that are operating in 3 different areas around the globe. So we've had South Africa, we've had the USA, and we also have the Caribbean. So we've had the pleasure of recording a video with Karen Seeley, who is a board member on the Healthy Caribbean Coalition. And she was able to give us some wonderful insights on the systems at play in Trinidad and Tobago, but also around the Caribbean. So this video will be going live within the next week or so. So please keep a lookout for that and we welcome you to share that across your networks as well. And so with that said, I'll direct it to Johanna. He's going to speak to you World Obesity Day and advocacy and our plans from World Obesity Federation as well.
Thank you so much, Yella, and thank you again to our hosts and to the Rotary for inviting us and including us. I do want to say a word of praise. I'm just going to be very brief in this presentation as well. We want to hear from you, but the Caribbean has, been the leader in non-communicable diseases. It's been the canary in the coal mine for the burden of non-communicable diseases, and had been important in really flagging this as an issue that went beyond health, around NCDs, and then more specifically around obesity, elevating that to the meeting that was held for ministers of health, the Port of Spain Declaration in 2007. And then the first of the four, what we're going to now have is our fourth UN high-level meeting on NCDs. The first one was in 2011. And again, a lot of this has been led by the Caribbean, and it's a variety of reasons. It's again, being in the, you know, at the coalface, as the Brits say, in the front lines of this challenge, experiencing a lot of the systemic drivers of it. And also, you know, having a very strong kind of advocacy connection and votes in the UN as a group of island nations with a vote each one and having a vote in the UN. It can be, as you would well know, a very powerful bloc. We're thrilled that Rotary has taken increased interest in this and really look forward to collaborating with you. We can cover that later, but I'm just going to give a quick snapshot. So this is our current 3-year plan. And in the dark gray, I apologize, we don't have a particularly like infographic visual friendly version of it yet because we've only really just finalized it. But just to highlight, in the dark gray, you see there's 4 targets that we're in official relations with WHO. We're the kind of key partner on obesity to WHO, and we work closely with WHO and UNICEF on coordinated action. And we've taken sort of four global targets and said these are our North Stars in terms of how do we all of these are actions that no one organization can do. It requires lots of people collaborating. So one of them is around the UN target of reduce, this is for the Sustainable Development Goals, reduce 1/3 premature mortality from NCDs. The second is halt the rise in obesity among children and adults, which is the WHO acceleration plan that was approved 3 years ago, almost 3 years ago. End all forms of malnutrition, which again is in the SDGs, approved in 2015. And then I think quite importantly across the bottom, UHC and the idea of access to health coverage and health packages for all. And I think in particular for this year, we're focusing on the upper left on that, reduced by 1/3 premature mortality from NCDs. The reason that there is premature mortality from cardiovascular disease, from diabetes, from cancer, from other NCDs is directly related to the role that overweight and obesity are playing in driving those diseases. So, and we've done economic assessment of that and the cost, showing the enormous savings that would be realized if people were not dying unnecessarily from diseases, other diseases that addressing obesity could have addressed. So that's just big picture. One more, if you can click on once more. And the way we do that is in the 4 areas on the bottom: advocacy, convening, education and training, data and evidence. We have SCOPE as our globally accepted and accredited education program for teaching, particularly healthcare providers and others working with people with obesity, how to address it. We have MAPS, which is our new mapping of where does obesity sit, what are the barriers and enablers in all countries, where we did the first round in 2019, and now the environment has changed a lot. And we do report cards for all countries. We have the Global Obesity Observatory and the Atlas, which will come out next Tuesday on World Obesity Day. All of these are ways that we try to capture the global information. One thing we tend to say about the data is that we continue to be, this data is sitting in our observatory. We continue to sort of pull out different pieces of it every year and add, a little bit of new studies. We continue to be shocked by the seriousness of the challenge. Childhood obesity rates going up. Certainly COVID did not help. Obesity rates going up overall. The next big milestone will be 3 billion people living with obesity. So much as we're great, there's been some great interventions, but there's absolutely not been enough. And that's our key message. We need to do much more. We need to resource the approaches we have. We need to understand that obesity is not one thing or another. It's both and. It's both a health and a food problem. It's both a rich country and a middle-income country problem or low-income country problem. It is also both a childhood and adult problem. So this is something that we really, the more we just are fragmented about it, the more we'll just see dire numbers go up. But the more we can work together, the more hopeful we can be. And the Caribbean plays an enormously important role in that because of your strong history of advocacy, legitimacy, power in the UN community. Next slide, please. I think it's possibly the last one. This speaks to some of the elements of the WHO acceleration plan, which we heartily support and which is underpinned by recommendations that we work towards, which are like essentially every country needs an integrated strategy that covers things like food marketing and reformulation, but also enabling physical activity, but also ensuring that that obesity is measured in the health system from early childhood on, and that there is a health system that is friendly to it. Education and awareness, all these different elements. Next slide, please. And so we are very supportive of the WHO Acceleration Plan, and there are some front-runner countries in the Caribbean, including Barbados and Trinidad and Tobago, I believe, that are doing a lot. For 2025 in our own work plan, you can see at the center, the big orange teardrop-shaped target there is the UN high-level meeting. We see it as an incredibly important moment to amplify attention. We're very supportive of the wider NCD agenda. We are very supportive of increased financing for Best Buys. We need to see more on obesity. The science has emerged and changed and evolved since the original targets were set, because that's 15 years ago. So we believe that addressing overweight and obesity can have a major step change in how we're doing in addressing NCDs more broadly. Next slide. So these are just a few key steps. Of course, we had scope sessions on obesity and children's health. We do scope sessions for healthcare professionals and others interested in this, and these are free generally. And please join us. Just come to our website. We have on Monday, we have a webinar launching the technical package of WHO. And we have our own webinar with a global coalition with UNICEF and WHO, and they're also launching a new technical package. There's new global burden of disease data, which is being launched. So there'll be lots of media coming up in the first couple of days of next week, and then World Obesity Day itself, where there will be webinars, events, walks, illuminations, reports, et cetera, et cetera. What we're proudest of with World Obesity Day is the sense of shared ownership about it. All we do is try to help offer the platform and some themes and designs. People run with it and do brilliant and amazing work. That's very, very, very impactful. So thank you. This is from last week. We had a number of Caribbean colleagues actually with us in Rwanda. There was the NCD forum, and we did a session with a number of different countries on how to launch it, how to have a social movement around obesity with a particular focus on childhood obesity. So thank you.
Thank you so much, Joanna and Yili, for your presentations. And we will definitely work for World Obesity Day, to engage in some of the activities, whether it's the walk for awareness or the lighting up of the monument to support what you are doing. At this point in time, I think we've had some fantastic information shared by all the panelists. And I would love to open up the floor for any questions, comments, input by any of the members who have been on the virtual webinar listening in.
Okay.
And hopefully by this time we've all finished our healthy lunches and nobody had KFC and beer.
Well, while we wait on the questions, we could perhaps now share some of the delicious meals that were consumed by our dear friends who have joined us for today. I see Alyssa Graham had salmon and quinoa salad and steamed vegetables. Another participant had an entire apple for lunch. Someone else had dal with tomato, healthy cinnamon, and cloves. I feel like if these are deliberately healthy, yes, well done so far, everyone. And someone else was finishing up their salad with tomato, eggs, apple, cucumber, and that his wife made him. So far, so good. While we wait, I'd also like to take the opportunity to welcome all the friends and family that we see online joining us today, and noting to the presence of some of our past district governors, many of our Rotarian friends, and industry leaders. So thank you so much for being here with us. We haven't seen any questions in the chat as yet, but we will give it a few more minutes. And my co-host will help us with that.
So we have a first question to the panelists. A question from Akenat Misir, a comment on gradual reduction of sugar content versus a banning of sugary drinks. Do the panelists have a comment on this? gradual reduction of sugar content versus a banning of sugary drinks?
I can weigh in a little bit. I'd love to hear if Joanna has something to, I'm sure she does, or of course, our nurse friend Samantha, who might have some great things. But I think the sugary beverages is a evidence-based strategy that has actually, I mean, it has been, the Caribbean has been very important to it, and in particular, well, so it's not banning of sugary drinks. Apologies, I'm thinking about taxation of sugary drinks. Banning anything like banning tobacco is very hard to do. So the pragmatic approach is to just continue to try to reduce demand. I mean, I think that that's based in a lot of evidence from other areas, but I'd love to hear from either Samantha or Joanna if they have other
Sure,
views.
thank you, and thank
Yeah.
you for the question. Very good question. And this question comes up a lot when we do our stakeholder meetings about our SSB policy. So as Joanna mentioned, it isn't the banning of sugary drinks. What, well, in Antigua's case, and I think DG Debbie mentioned in Trinidad's case, it's the banning of specific sugary sweetened beverages in schools. So with regards to the gradual reduction, so we know that our consumption of sugar in this region is quite high. So we're not saying you cannot have sugary sweetened beverages. What we're trying to do is to educate the population, the general population, on moderation and how harmful that too much of these added sugar products can have on our health. So, you know, just trying to change the narrative there that yes, sugary sweetened beverages do exist. We definitely, as mentioned, cannot ban it, but it's to control and help persons, you know, control the amount. And in our case, we're starting with the school-age children because, of course, those would be easier, that population would be easier to control. And plus, they get sugar from other things like their fruits, if they're using 100% juices. So they are still getting sugar. So it's not a complete ban. I hope that answers the question.
If I may, I will also contribute to this discussion because I believe that this is one of the most important areas of intervention that governments should not hesitate to, you know, just to take steps. Of course, we are not talking about banning and making it illegal to drink cola, Coke, or whatever other sugary drink. And I'm sorry that I'm talking about Coke, but this is the most accessible drink at the community level, oftentimes having better logistics than clean water. So, you know, this is a good example of something that is harmful, especially for the poorest communities. If it's so accessible and we know it is harmful, it should be more difficult for the companies that are distributing such a cheap and harmful product to operate on the market. So you have taxation, you have price regulation, you have marketing regulations at your disposal to make it a little bit more difficult. And here in the Caribbean, we have local food producers, but also beverage producers, which are massive businesses, and they're making money on sweetened water of every kind, in every color, and in every, you know, flavor. And there's nothing natural in those bottles, and it adds to the pollution, it adds to the obesity issue, it adds to cancerogenic, you know, effects because of the color they use in those bottles, in those drinks. And I think that we should not hesitate, but really prove it that it has incredibly heavy burden on the health system, on the community level, on the family level, and that these things have to be eliminated, gradually eliminated. There's no added value of drinking those sugary drinks whatsoever when it comes to health outcomes or nutrition outcomes in the individual, you know, health situation.
Thank you, Joanna. So to add to this, what you're talking about, I saw another question from Kari Lewis. What are the views on zero sugar carbonated water drinks, such as Sifo or Polar, as a substitute for sodas?
Well, I'm not expert, but zero sugar never translates to not sweet. You know, sometimes these are sweet things with some additives or some sugar substitutes, which are not better in terms of health outcomes than the actual sugar. Sometimes sugar is actually a better or least evil than those substitutes. So we have to be very clear about this. And the healthy drink is water and, I don't know, green tea. Let's just talk about the healthy choices instead of finding excuses for poisoning people across the board and distributing this kind of sort of lenient way of. And I say this in a very, very straightforward manner, not because I'm from Europe, Eastern Europe, and we are very straightforward people, but I think that these are hard and important choices that policymakers need to take on behalf of people who are addicted to sugar. And when you look at it from the addiction perspective, it is a duty of the duty bearers, in this case governments, to regulate access to this very harmful substance. Alcohol is restricted for the young people. Tobacco is restricted for the young people. You have additional restrictions in terms of price regulation. Let us take these things very seriously, because sugar doesn't really play such an important role in our diets as it did 100 years ago, when we needed to have it for survival. Now we need to not have it in order to survive.
Maybe I can jump in too and say that, yeah, I think that if these are, I don't actually know what SIFO is, but I'm assuming it's something with, as Joanna was saying, some dubious chemically named product that gives it a particular flavor, which is, we're already seeing even things like sugar alcohol, which is meant to pull out the kind of, supposed to be a healthier substitute, but there's starting to be evidence around cardiac impact of, sort of cardiovascular impact of those. So WHO has one position paper, but not completely conclusive position on artificial sweeteners as generally not being great, is I think how they would put it. But maybe to link to what I saw was another question in the Q&A, which was around carbs, which similarly, I think carbohydrates, many cultures consume carbohydrates, with no negative consequence, particularly when they're offset by, fiber rich diets. It's more about ultra processed foods. And so I think it's about ultra processed foods and ultra processed beverages that's where the real negative health consequences happen. And it's also just because we don't know exactly why or have an exact cutoff point at what something is acceptable versus not, doesn't mean we should just sort of allow it to infiltrate our communities without sort of placing restrictions on it, because clearly there's a lot that's not good for people's health about ultra processed foods. So sort of answering one question about the carb question, and there's also similarly, the same thing in terms of these beverages. I don't know if others have more to say on either of those, carbs or.
Thank you, Joanna. Oh, the question that Joanna was talking about was in the Q&A about suggested approaches for communities whose main staples are carbs, especially indigenous populations and rural communities. But that's why she was talking about ultra-processed foods versus natural foods. A gentle reminder that Tariq Jagnarayan shared is that the main issues are not around diet only. However, multifaceted cultural norms, views, and practices. For instance, fat means healthy in some communities, sedentary lifestyles, screen time, change in recreational choices, poor urban planning, etc. So that's a gentle reminder that Tariq wanted to share. Coming up to, I think this is Sean Petty's question. What are some actions that community leaders can take to help promote healthier lifestyles from both food/drink consumption and physical activity perspectives, especially among children?
I'll just say one thing, which is model the behavior that you want. I mean, that's enormously powerful to have community leaders, walking the talk, and that's where sort of, Jamaica moves and Trinidad and Tobago moves and all those tend to have leaders involved. That's great. But I think also, finding ways to navigate what I know is a very complex environment with private sector drivers of both unhealthy foods and drinks, but also I think increasingly of mental health. I mean, we're seeing, we were talking in Kigali about the commercial determinants of mental health, which is things like the mental health challenge is also associated with excessive screen time. So it's about walking the talk. It's about investing in the community as ground zero for people's best shot at healthier lives. And that community also includes healthcare facilities, but which is where some of the hospitals work that Samantha was describing is so extraordinarily encouraging. Thanks.
I'll also like to jump in here on what actions that community leaders can do, as Jonna just rightfully said, leading by example. And one of the things that can be focused on is looking at marketing. So, when there are events, looking at your sponsors in terms of the sort of things they provide, have a no list. No, we do not want this. No, we do not want branding of this. And this actually helps because we know our children are visual consumers and they see things over and over and they say, oh yes, I went to a Rotary event and they were having Coke or they were having chocolate or something like that. So we have to be careful with the marketing messages or subliminal messages that we may be sending through our sponsors as well. So that I think that is one way that community leaders can help to promote healthier lifestyles. Thank you.
Thank you so much, Samantha. So coming we heard what the community leaders can do, but a question for our DG: how could Rotary District 7030 contribute to this obesity campaign?
Well, Victoria, we already have the MOVES initiative, which is currently going on. And in fact, in my closing, I would be talking a little bit more about that. So unless we have further questions, I can perhaps move into that segment of it where I share a little bit more.
Yes, please go ahead.
Okay, great. So thank you so much to all the panelists. I just want to share with the participants and everyone on the call, under the motto, Service Above Self, Rotary International is an international service organization that aims to bring together business, professional, and community leaders around the world to champion peace, fight illiteracy and poverty, promote clean water and sanitation, and fight disease. Our district adopted childhood obesity prevention as a priority program under two of Rotary's areas of focus: disease prevention and treatment, and maternal and child health. And as one of the childhood obesity prevention endeavors, District 7030 promotes the District 7030 Moves Preventing Childhood Obesity. And this is a district-wide campaign to encourage all of our members and clubs to continue to take action and mobilize against childhood obesity, promote healthier behaviors and lifestyles, advocate for obesity prevention, and peace-building policies and legislation. And this is the activity we are doing. For the 4th annual Obesity Awareness Movement, each Rotary and Rotaract Club was challenged to carry out various types of physical activity and join the Moves Step Challenge from the 15th of December 2024. Such activities were done on an individual or group basis, and it happened over a 3-month period, with the last days of reporting on activity being the 4th of March 2024. I should tell you that I am number 161 or thereabouts in the campaign. I'm not at the top of it, but I'm still competing. Now, to conclude the campaign, District 7030 designated Sunday, the 2nd of March 2025, as an official Rotary Day of Service focused on promoting physical activities as part of a healthy lifestyle among both adults and children. Under the World Obesity Day's theme for this year, Changing Systems, Healthier Life, I, DG Debbie, hereby give the start sign for the 4th Annual Rotary District 7030 Obesity Awareness Movement, a district-wide activity for Sunday, March 2nd, 2025, in which all members of the district are invited to participate. And while I am sitting, I really feel as though I should have been running off at that point in time to get the moves going. So that's what we are doing in the district. And again, I say it was really a pleasure being here this afternoon. And I'm going to hand back over to our moderator, Sharon, to wrap up and give us a vote of thanks. So thank you so much, everyone.
What a wonderful afternoon we've all had, folks. Thank you so much for being here. And it has indeed been a privilege for me to have participated in it as well. I'd like to thank all guests present today, but specifically, I'd like to extend my heartfelt thanks to my dear friend, Samantha Moit, our representative from the Ministry of Health, Antigua, our United Nations representative, Joanna Kazana, and our 2 reps from the World Obesity Federation, Yele Fatwara and Johanna Rolton. I'd also like to thank our 2 local sponsors for this event, who are Healthy Choice FM radio, with dedicated health and wellness radio, it's on 49.9, and our Medical Path Clinical Laboratory. I'd very much like to thank my favorite hotel and Bay House Restaurant, Tradewinds Hotel and the Bay House Restaurant, for providing us with a scrumptious, healthy, low-carb, high-protein meal. I'd like to thank all participants who were here today, and especially to our background support team with us here and across the Caribbean. I'd like to thank the interpreters, and I'd like to thank all those who supported. Last but not least, I'd like to thank my very able-bodied assistant, co-moderator, Victoria. Thank you, and have a blessed continuation of your Tuesday afternoon and the rest of the week. Much success with all the activities in commemoration of World Obesity Day 2025, based on the theme, Changing Systems, Healthier Lives. Thank you very much all. Have a good afternoon.
Thank you.